about keloid scars, I have seen a lot of success with really great along with that previous question about a raised bumpy scar or a hypertrophic scar, and this question about keloid scars, I have seen a lot of success with really great scar tape. And the scar tape that I loved by Spider Tech Tape is no longer being carried, but I am almost positive that I have sourced a really great replacement, which is exactly the same tape, just carried by a different company. So following up on them, I will have news for you hopefully within the next few weeks, but let me know if this is something that you are interested in, because scar tape can make a huge difference in keloid and hypertrophic scars. I will note about keloids, if it's itchy or painful, please see your doctor. Oftentimes there are some injection therapies that could be quite helpful and immediately. If your external scar doesn't really move downwards the same way that the non-surgical part of your abs do, then you gotta start pulling and holding it downwards. So this mama here is in my cesarean recovery program, and she's on the second of 4 modules, and so she has been pulling upwards, and what she needs to do is just pull down. Pulling down so that she gets to the end of that skin mobility, and depending on where she is in terms of her healing, 2 out of 10 pain is perfectly fine. You want to get that stretch and you want to hold it. You're going to hold it for 5 to 10 nice gentle belly breaths, and at a certain point you're going to start to feel the tissues kind of giving. So once that happens, then you let go of your pull and hold, work along the entire scar, especially the areas that are most restricted, and don't forget to follow up with a cesarean specific movement to hold all those changes. How hard should I press when doing my own scar massage is one of those questions you need to ask yourself all the time. So when you work with me during my cesarean recovery programs, you'll know to answer 2 questions. 1 is, what is my pain? 2 is, what is my mobility? Let's talk a bit more about what that means. What is my pain means some techniques you actually want to feel discomfort. You want to feel some pulling. So if 10 out of 10 is the most extreme pain you've ever felt, when you have full mobility superficially but you feel lumps below, you probably want to push until you get a 2, 3, or 4 out of 10 for pain. Next, what is my mobility? So how well does that move compared to a non-surgical part of your belly? So in this case, if there are lumps, it's not moving nearly as well as non-surgical, so you want to be massaging that area more vigorously to match the non-surgical site. In my opinion, the only wrong way to massage your C-section scar is if you start too soon, meaning if you start before the 6-week mark when you're discharged by your doctor. You gotta make sure that there's no infection, and you gotta make sure that your scar has healed closed. And I guess the other time that you would do it the wrong way is if you massage it way too hard and too deep than what your scar is ready for, and that, quite frankly, is not very common. Listen, after major abdominal surgery, it's important to know how to massage your scar. It's important to know what massage techniques to do. It's important to know that you're doing it right. But most importantly, you need to know that you are doing the massage techniques that your body specifically needs. So the answer is, like